Welcome, everyone, to Building Healthy, Equitable Communities, a training series from ChangeLab Solutions. This is a virtual space to explore the elements of a just community and the conditions that will help all children and families thrive. Back in April, we began releasing collaborative episodes which offer training and discussion on how policy plus community power can advance health equity. You can see the full schedule and our 6 episode topics here or on our series homepage. Our kickoff episode explored health equity as a principle and a practice and set a high-level theoretical framework for how to use law and policy to advance health equity. The rest of our episodes lay out strategies for operationalizing this framework. For example, our second episode explored advancing health equity through policies and systems that support working families. And last month, we held our third episode, which looked at advancing health equity through a just food system and equitable procurement. All 3 of these episodes can be viewed on our website, and the link is there on the screen. Today, we're here for episode 4, Building Healthy, Equitable Communities Through Comprehensive Long-Range Planning. And just like the previous episodes, this webinar will be posted on our website, so you can come back to re-listen to the webinar or view the slides we're presenting today in case you miss anything. If you're wondering exactly what an episode is, let's recap. Each episode contains 3 things. First, we publish a blog post which investigates the consequences of laws and policies that don't take health equity into account and how we can respond. In episode 4, we looked at 8 policies that have contributed to place-based health disparities across generations. Then, we host a webinar that provides both on-the-ground stories and innovations from community leaders, as well as resources to support your work in healthy change-making. Today's webinar explores how long-range planning can counteract the type of historic issues explored in the blog and create places that support health equity. Finally, we close each episode by moderating an interactive expert panel. For this episode, please join us on Thursday, August 23rd, alongside Andrea Nelson from the San Francisco Planning Department, Kate Kingery of County Health Rankings and Roadmaps, and Stephanie Garcia-Vaz from the City of Henderson, Nevada. Collectively, this panel brings diverse experience and innovation in place-based planning and investment. You can expect them to be in conversation with each other, as well as responding to questions from you. As such, please note that we will not be doing Q&A during this webinar, but instead we're deferring them to our expert panel. So please make sure to submit your questions as they come up in the chat box on your screen, and we'll address them with our panel on Thursday. A suggested tip, even if you can't attend the panel, you'll receive the post-event recording if you register. So you can put names and faces to the voices you'll hear. I'm Eric Calloway, and I think I'm even wearing that shirt today as a coincidence. I'm a senior planner at ChangeLab Solutions, where I focus on how place-based policies, systems, and environments affect health equity. My background is in urban design and land use planning consulting. I've been in the field for over 15 years and have worked on a range of citywide, downtown, district, and corridor plan documents, as well as a number of streetscape and public space improvement projects. On today's webinar, I'll be joined by Moses Gates, the Vice President for Housing and Neighborhood Planning at the Regional Plan Association, or RPA. RPA is America's most distinguished urban research and advocacy organization. RPA works to improve the prosperity, infrastructure, sustainability, and quality of life of the New York, New Jersey, Connecticut metropolitan region. Moses leads the organization's planning, research, and advocacy efforts in affordable housing, economic development, and urban design. RPA has a deep history in visionary long-range comprehensive regional planning. On the heels of the release of their 4th regional plan, I'm very excited that we all get to gain some insights and lessons learned from Moses about RPA's recent experience doing some very innovative work in this space. So, quick disclaimer, ChangeLab Solutions does not enter into attorney-client relationships, and none of this presentation is legal advice. We're extremely happy to have you all with us for this webinar. We have a wide range of sectors represented in today's audience. We have city planners and land use professionals. We have public health professionals. We have community development workers. I see some social service providers, some advocates, some funders, some educators, some students. And of course, we're all residents of the communities where we live. And that's fitting because long-range comprehensive planning involves a wide range of partners in a wide variety of sectors to take a lot of different actions. With that said, in today's webinar, we're going to talk about long-range planning strategies that advance health equity. I'll start the webinar by providing context about the connection between places and health, and then introduce how policies such as long-range comprehensive planning can be used to shape places to improve health and reduce health disparities. We've invited Moses to bring the work of equitable comprehensive planning to life by sharing the story of how RPA's 4th Regional Plan puts these ideas into practice. Finally, I'll close by sharing a few resources for further reading and sharing information about the next episodes in the series. Now, when we talk about the connection between place and health, it's important to be clear about what we mean by health. Health is a state of not just physical, but mental and social well-being, and is not merely the absence of disease or infirmity. But if we're concerned about people's health, why focus on healthy places at all instead of individuals or even just healthcare? Because we only spend maybe 30 minutes a year with a doctor. The other 365 days, 24/7, we spend outside the hospital. It's our daily experiences of where we live that truly determines how healthy or unhealthy we are. In fact, studies show that healthcare services are only responsible for about 20% of our health. The large majority of our health is determined by our behaviors and the context of the physical environment and community systems that surround us. And this is commonly referred to as the social determinants of health. Of course, that starts with our relationships, including our family, friends, peers, and partners. The physical environments that shape our health include our workplaces and our homes, where we shop and get services, our schools, community gathering places, and public institutions, where and how we grow, buy, cook, and eat food, the transportation networks that get us from place to place, and networks of open spaces throughout our communities. But the broader community context that shapes our health includes the regulations, law enforcement, and city services provided by government and institutions, market demand, investment trends, and other economic forces, the network of family and social services that support children, elderly, victimized, and other vulnerable populations, clean air and water, weather events, soil, and other elements of the natural environment, biases, social norms, and media representations of society, and safety, trauma, and community cohesion. The way we experience these elements in different places is a central part of what makes them healthy or unhealthy. For example, looking from left to right, when the places we just reviewed are unaffordable, unmaintained, inconvenient, unsafe, or lacking quality education and job opportunities, they can be experienced as unstable, dangerous, or just inconvenient and hard. And this can lead to poor physical health in yellow, mental health in red, and unhealthy behaviors in green. And these all affect long-term health outcomes in blue. So what do policies have to do with determining the characteristics of where we live, work, play, and learn? They play an important role in guiding a broad range of actions that combine to shape places over time. When used strategically, policy can be an effective tool to transform communities in ways that will improve health and reduce health disparities. Long-range planning in particular can influence local investment, shape markets, and determine where the private sector, the government, and institutions invest to support healthy community transformation. We just need to look around to see the powerful role that long-range planning plays in shaping where we live. A good place to start is by understanding ways that this has happened in the past. For example, financing policies such as redlining shaped what neighborhoods received investment and who benefited. These policies labeled white neighborhoods the, quote, best or desirable for investment, while labeling minority neighborhoods as, quote, declining or hazardous, and therefore they became risky or poor investment prospects. This played a central role in post-war city center disinvestment and neighborhood-level segregation. Federal housing policies and accelerated depreciation tax policies played central roles in guiding investment to suburbs throughout the second half of the 20th century. Because of these policies, between 1945 and 1959, 98% of federal home loans went to whites. In the 1970s, suburban employment followed educated workers to the suburbs in outnumbered city jobs. And by the end of the century, 20 malls were being built per year across the country, mostly in auto-oriented suburban locations. Interstate highway policies subsidized a type of transportation access and road capacity that supported and reinforced the suburban investment, which then shaped subsequent development as heavily auto-oriented. And local land use regulations shape local patterns of real estate investment, which has a strong influence on the socioeconomic and demographic makeup of different neighborhoods. The end result has been decades of unevenly distributed infrastructure and development. To make matters worse, the funds used to pay for infrastructure and development in these newer neighborhoods often comes from government revenue that's generated by older parts of the community. And this has acted as a hidden subsidy for the wealth that has been generated in these newer neighborhoods. We can see the health results of this policy-driven pattern of segregation and development in communities across the country. Let's look at Baltimore as a case study. Some neighborhoods in Baltimore have seen policy-driven disinvestment and marginalization since at least the era of redlining in the 1930s. We can see how, in comparison to the first and second grade areas, the neighborhoods labeled as declining or hazardous were majority Black, immigrant, or individuals with mixed-race parents. And they were cut through or isolated by freeway construction. We can also see how these policies segregated neighborhoods across the city. Today, families in these neighborhoods are predominantly non-white and can face overwhelming odds. If they own a home, families in these neighborhoods have significantly less property-based wealth, with homes from 5 to 20 times less valuable. On average, they must get by on less than 1/3 of the income, and family members being as much as 5 times more likely to be unemployed. These residents are half as likely to have a bachelor's degree, and the children are almost 5 times more likely to be suspended from school. They experience double the rate of violent victimization and are significantly more likely to have had adverse childhood experiences. From a health perspective, they are twice as likely to have chronic obstructive pulmonary disease and twice as likely to have coronary heart disease. All told, a child born in these conditions can have as much as 20 years shorter life expectancy than a child living 5 miles away on the other side of the interstate highway. And this is a pattern of health disparities is not unique to large urban centers. If you are in one of the largest 500 cities in the country, you can see census tract level health disparities data in your community on CDC's 500 Cities Project website. And we'll hear more about health disparities data as well as the experiences in less urban contexts in Thursday's expert panel. Now, how can long-range planning improve health and reduce health disparities? It can focus on eliminating the differences between healthy and unhealthy places. But to have that outcome, it needs to be done differently. Historically, long-range planning has been focused on preparing to accommodate future community needs based mainly on anticipated growth and development. It's generally done at the regional or citywide scale and focuses on the distribution and intensity of land use based on that growth and the infrastructure and emergency services needed to support that growth. But remember, as we've just seen, that healthy places are much more than just land use and infrastructure. We need to plan for a broader range of future community needs that consider people's experiences and the fact that some neighborhoods are healthier than others. And we need to do a better job of being more inclusive as we plan to make sure we consider how every person, family, and child in every neighborhood will be impacted by these plans and the subsequent growth and development that follows. This is important, not just because patterns of investment are heavily influenced by planning policies. It's important because market-driven investment is generally not concerned with furthering equity. And many historically marginalized neighborhoods are at risk of another generation of planning policies, growth, and investment that ignore their needs and widen health and wealth gaps. This is especially true where there's a risk of displacement, something we'll hear more about in our continued conversation on Thursday. Now, long-range plans can address this risk. They can identify what's happening, such as recognizing that land use, transportation, housing, and other regulations are contributing to disinvestment, displacement, and health disparities. And they can establish a set of prioritized strategies to reverse those trends. They can establish a vision for what a healthy community looks like to its residents and define community-driven goals to realize that vision. And then they can coordinate a wide range of actions, projects, and procedures that local governments, agencies, institutions, and private partners can all take together to implement the plan in support of healthy communities. The types of actions and tools involved in implementing long-range plans include policies that are often directed by municipal planning or community development departments, such as detailed plans, often called master plans, that address specific topics like transportation or open space, or that focus on specific districts or neighborhoods in a community. Zoning, which regulates the use, shape, and performance of real estate development. And ordinances, resolutions, licenses, and permitting processes. Municipal actions include capital improvements like complete streets projects, open space improvements, and other infrastructure projects, which can be managed by local public works departments or built by private developers. And programs and incentives such as tax changes or community safety and violence prevention programs involving community development, human services, police, fire, and health departments. Finally, implementation often requires changes to government procedures and practices, such as how and when interdepartmental interagency coordination occurs, how project priority decisions are made, how budget spending decisions are made, and how and when residents and stakeholders are involved in projects, prioritization, and budgeting decisions. And all of these are things that can be addressed in long-range comprehensive plans. You can organize health-related content in long-range plans a variety of ways. But what's important is that the plan clearly states health or equity goals, and that the plan identifies specific policies that will achieve those goals by addressing a range of community conditions like those that we've reviewed today. Because all these actions can involve such a variety of agencies, organizations, institutions, and individuals, it's also important for plans to identify who's responsible for implementing these actions. To do this type of healthy planning, we need community engagement, capacity building, and law and policy change. And we need to make sure every phase of these planning processes contribute to equitable policy outcomes. Now, we'll hear from Moses about how RPA grappled with these issues when creating the 4th Regional Plan in New York.
Thanks, Eric. I wanted to kind of start by going over the history of planning in general. There's really interesting history to what's happening now and what happened for our first regional plan when we started back in the 1920s. Planning really came about because we were trying to take the unfettered development and unfettered kind of market-driven approach to city development and layer on that what was back then health outcomes in terms of sanitation, in terms of disease control, and in terms of getting better living conditions and healthier living conditions for most of the residents. The very first effort at city planning here in New York was the institution of the Department of Sanitation to clean the streets from what was then all of the horse manure and other garbage and make it into a healthier place. The delivery of our water system in the mid-1800s was not so much so that we could get a fresh glass of water coming out of the pipes. It was to combat the cholera epidemics that were happening all over Lower Manhattan in the kind of early mid-1800s. And this is where the concept of urban planning comes out of. It comes out of health outcomes, and it comes out of trying to get a healthier and more equitable place to live. And throughout history, that focus has come and gone. But that's really what's behind the concept of long-range planning and what we do here at RPA. So we started way back in the 1920s when the 5 boroughs in New York City, Brooklyn, Bronx, Queens, Manhattan, and Staten Island, had consolidated a few decades previous, but we were starting to get development out into New Jersey, up into Connecticut, and places where we couldn't consolidate politically and do a really comprehensive plan. So that's why we're a nonprofit organization. We were put together by kind of the civic institutions in the business community at the time to put in place the recommendations that the federal government and the different states would have to do. We're why the George Washington Bridge is where it is. We're why the Palisades are where they are. And the last piece of the first regional plan happened in the 1960s with the creation of the Verrazano Narrows Bridge. And we had a reckoning saying, well, if the first plan has either all been implemented or has kind of gone the way of different trends in urban planning and isn't going to be implemented, what as an organization do we do now? So we came up with our second regional plan in 1968, our third one in 1996, and our fourth one we just put out last year and is our first web-based plan. You can see it at fourthplan.org. In the 1960s plan, we had a pretty comprehensive equity and health focus, and in the 1996 plan, we had a little bit less of a focus and a little bit more of a focus on reviving the economy of New York City. The early 90s recession hit New York extremely hard, and the conversation then was, will we become economically relevant again? Will we have the kind of economic growth and return to being an economic urban center in the United States and the world? And obviously that question has been answered, and we're seeing kind of the effects of that in terms of inequitable, in terms of income inequality, in terms of not really having a comprehensive plan to make sure that all of the residents of the region are benefiting from our economic growth. So that was a real focus behind the fourth plan. Looking backwards, you can see the income inequality is probably the biggest story of the New York region, if not the United States. And the health inequality is something else that we really focused on. For the first time, we kind of started looking at things like life expectancy and health outcomes on a geographic basis. And the result is not very surprising. The wealthier and whiter communities tend to have better health outcomes and longer life expectancies. And how to do a long-term plan that kind of combats that and makes sure everyone can participate not only in the economic prosperity but in the quality of life prosperity that we have instituted here in the region was something that we took a hard look at. And we also took a look at a lot of the challenges of the future and how that's going to affect not just spatial patterns, but also things like crowding and other kind of health things that can affect health outcomes. Sea level rise is going to be probably the biggest story of the next few decades in terms of what's going to affect the urban environment, especially here in the New York region. And we wanted to look at that not just in terms of the spatial aspect of sea level rise, but we needed to look at the social aspect as well. How many people who are vulnerable are going to be subject to sea level rise in terms of economic vulnerability, in terms of housing insecurity, and in terms of folks who aren't going to have very robust options for relocating with sea level rise, and how we're going to address that. And we created a vulnerability index that we overlaid with our sea level rise map to see what the results of this are going to be and to put in place recommendations and policies to address it. And another big story, and this is one that's kind of come up over the last few years and wasn't necessarily a focus when we started the plan way back in, I think it was 2014, but our infrastructure, we always knew we needed a modernization program for the subways, our other rail lines, and to a lesser extent some of our other transportation infrastructure, but that story is really coming to the forefront now. And in addition to kind of a general upgrade, we took a look at what is accessible for able-bodied folks and what is accessible for people who need extra accommodation and confirmation with the Americans with Disabilities Act. And we are one of the, because of the age of our system, I don't want to say it's kind of an intentional thing, we are one of the worst conformers in terms of our mass transit system with the Americans with Disability Acts. And you can see that the inaccessible stations we have here are vastly outnumber our ADA accessible stations, to the point where there's certain trips and certain locations in the New York City region where you're not really able to find an accessible subway station within several miles along a line. And so we put in place the recommendations and a schedule for how we are able to retrofit our subway stations, not just in a way that is aspirational, but in a real way that can improve accessibility for more and more people on a realistic schedule. And in addition to our nuts and bolts transportation and physical infrastructure, we also took a hard look at our social results in terms of education and in terms of kind of lifetime income earnings. And we overlaid that by income and also by race. And you can see here our public school quality has severe racial discrepancies, and we have severe segregation in our public schools here in New York by race. And that's something that's only, the conversation about addressing that has only really just started over the last year in New York City, and really hasn't even gotten going in the rest of the region on how segregation, both housing segregation, especially educational segregation, which is not, at least in New York City, solely a result of housing segregation. Even in integrated neighborhoods, there's still a disproportionate amount of educational segregation by race, and how those things affect future potential and how those things affect public health. So we, for the first time, focused on health and equity in addition to prosperity and sustainability for our plan. And those are the four lenses that we saw our long-range planning for. How do we make a more equitable region, a healthier region, a more prosperous region, and a more sustainable region? And like I said, we wanted to bring this kind of full circle. The public health is something that you can see from the quote on the left is the main driver of almost every comprehensive urban planning effort that is kind of started. It was all as a result of, generally speaking, trying to eliminate disease epidemics, but also otherwise trying to improve health. It wasn't about commuting time. It wasn't about economic development. It was about health, and that's something that we very much tried to get back to, and also to address kind of the inequalities that exist today in that. And in order to do this, another thing that we started to do is really take more of an on-the-ground approach to partnering with community groups. In some ways, the added data availability that long-range planners and all urban planners have now is an incredible asset. We have data and computing power at our fingertips that we didn't even have for our third regional plan that we did in 1996. The kind of flip side to this that we noticed is it's easier and easier for us as planners to kind of sit at our desks and get overwhelmed with the data and really kind of focus on that. And we, to some extent, when you do that, you a little bit lose kind of the human element, which is just as necessary for a good long-range plan as the data element. So we made sure that in addition to taking all the extra data and computation power that we were putting into our fourth plan, that we really ramped up the partnership with local community groups. We did surveys, focus groups, doors, but the biggest thing I think that we did is we went to the on-the-ground. We didn't try to do it directly. We went to the on-the-ground organizations that had histories in a lot of low and moderate income communities and communities of color, and we relied on their expertise, and we relied on that partnership to kind of drive the informational process, not just in terms of a granular way, but really in terms of, number one, setting priorities, and number two, getting us to look at things we wouldn't have otherwise looked at. One of the biggest things we kind of found, especially in the more suburban parts of the region, was that there was a real lack of non-auto infrastructure that we had kind of known, and we've always been big proponents of, kind of better bike, pedestrian, public transportation options as urban planners. But what we didn't know was that lack of non-auto infrastructure in the suburbs extended much beyond what we thought, and had a big equity component in terms of folks who weren't able to use or afford automobiles to get to work, and had a public health component in that there was a severe lack of safety in terms of the bicycling and walking to work along roads, and in some cases, actual highways that weren't designed for that kind of transportation. And that's something that we had not really looked at as in depth, and as a result, we kind of went beyond just the city bike and pedestrian infrastructure and kind of those areas that we knew there was a demand and an ability to do, and went into kind of the more suburban areas to make sure that there was the ability to have real transportation options that didn't involve having to use private automobiles, not just from a transportation aspect, but really from a public safety aspect as well. A few of these kind of engagement efforts really let us focus in on our 4 challenges that we wanted to do. We originally had 3. We had climate change, affordability, and transportation as kind of our focuses. But after a lot of this engagement, what we really learned is that all 3 of those things stemmed from one issue, which was a failure of the institutions that are supposed to be addressing these issues. It was the kind of thing where the more and more problems that we heard from folks we engaged with, the more us as planners linked those to the institutions that were supposed to be solving these problems and weren't. And that was what was kind of behind adding our 4th focus to this, which is a real focus on trying to make institutions more responsive to the population in general, but also the needs of low and moderate income folks, to improve communication and to improve responsiveness and direct responsiveness to that as part of a long-term planning effort. We came up with a few things from this. One of the biggest ones is our idea for a regional coastal commission. Right now there are, I'm not going to count the number, I used to know this but I've forgotten, but there are several different government agencies at the local, state, and national level that manage things, that manage the space that is vulnerable to sea level rise. And we thought that we needed one agency that could coordinate this and address the challenges in the future, and we're starting with trying to just raise the idea before we think of the kind of the legal implementation, and it's already starting to become part of the conversation. And then we wanted to do something, for lack of a better term, that was just kind of fun and improved quality of life, not necessarily for any other reason than because people should be able to enjoy life a little more. And I think that's something that we miss as planners sometimes, is the idea that not all of people's lives are about how quickly they can get to work, and the efficiency of the built environment in terms of housing and economic development and things like that. One of the great benefits of cities and regions, and especially our really kind of diverse region here in the Northeast, is that there's just a lot of stuff to do and things to see. And the discrepancy between kind of folks with money and their access to all of this and folks without money is huge. And, it's always going to be an issue, but we thought it was an issue that was kind of well beyond what was fair. And most kind of parks and cultural institutions and things like that are much more accessible to folks of kind of wealthier means than those that aren't, just spatially. And so when we looked at creating a tri-state trail network, which was taking certain rights of ways and things like that and making it an integrated trail network, we really did that with an eye of how can we make this accessible to more people and more people of different communities and different means. And the same thing with our subway service. When we looked at what expansions to recommend for the subways, we looked at three things. We looked at existing service, we looked at population density, and then we looked at communities, low moderate income communities who needed better subway access. And this is especially an issue today where subway access and public transportation access is something that is increasingly desired by kind of wealthier communities, which was not necessarily always the case in the past. So now, unless you actually look at these things with an eye towards better service of low and moderate income communities, the trend really is that wealthier communities get better public transportation access through gentrification, through displacement of lower income communities with better transportation options, and that we need to look at in the future putting in place better transportation options with an eye towards kind of transportation equity as well as just existing general service. We looked at kind of how to reprioritize street space, especially with the advent of autonomous vehicles and on-demand vehicles that we see as coming, and how we can make that serve walking, biking, and alternate transportation options a little bit better. And then another thing is for our first plan we proposed, I don't know the exact number, but it was several hundred miles of highways. And our second, third, and fourth plans, we have proposed negative numbers of highways. We kind of have been trying to dial it back ever since, both for kind of better transportation reasons, less private automobiles and more public transportation, but also for health impacts. And how we can, reduce pollution and tie communities back together. And again, it's really easy to say something like, we're going to kind of just get rid of this highway and make a park or something like that. And we needed to look at the economic realities, the engineering and structural realities as well, and come up with kind of a realistic prioritization of what we can do. And we identified several different kind of spots that we thought would be good to either deck or boulevard, essentially, to reduce pollution. And as part of that, we had that data on the health impacts, and we looked at those places where we thought there would be the most positive health impacts, and especially in low and moderate income communities throughout the New York region. Our housing, we also kind of looked at how we can create more housing in the existing framework and how we can make a more integrated environment as well. One of the things that we were very conscious of is how do we not just build more housing, which is needed. We have a dramatic housing shortage here in the region, but how do we do it in ways that makes more affordable options in wealthier areas? And one of the big things we came up with was just a very simple allowing accessory dwelling units and subdivisions in kind of very exclusionary single-family areas. Most affordable housing conversations in New York City focus on essentially government-subsidized development, which is important and a big piece of the puzzle, but we're also going to need kind of ways that we can get naturally occurring affordable housing as well. And a very simple concept is if you have a very large, McMansion or something like that, and you're allowed to make it into a two-family home, you're necessarily going to have twice as many, homes for twice as many people, and each of those homes is going to be at a lower price point. Our other part was kind of a better encouragement of transit-oriented development through municipal zoning and planning reforms to build things near rail stations as the other part of the equation, and how to get newly constructed housing as well as using our existing housing in a better way. That is all we have for kind of our focus on equity and health in the 4th Regional Plan for this presentation, but I think there's, it's something that permeated every part of what we did. And if there's, questions or things like that, I know that, our contact information I think is going to be disseminated, and we'll be happy to continue the discussion. I want to thank ChangeLabs and Eric for having me on.
Thank you very much, Moses. That was fantastic. And for everybody on the webinar, really encourage you to go to RPA's website and check out the plan and also the website. It's really a great plan. So if you have questions about long-range planning and health equity, please be sure to add them to the Q&A box before you head out. You can send them by email, or if you come back for the continued conversation, you can ask them on Thursday, and you can register for the continued conversation on the series homepage. We're excited to announce that Episode 5 will be launching in September. It will explore advancing health equity through transforming the school climate. And to learn more about how well your, in terms of some resources for long-range planning, to learn about how well your current plan in your community might address health, you can check out our Healthy Comprehensive Plan Assessment tool. To dig deeper into specific elements of healthy places, visit our Healthy Housing Toolkit, our Complete Parks Guide, or our Guide to Building Healthy Streets. For guidance on community engagement or multi-sector collaboration, we have a Changemakers Guide and a series of health and all policies resources. You can please stay tuned for Blueprint for Collective Action. That's a guide that we'll be releasing at the end of this series that focuses on how communities can address health inequities. And if you don't happen to see what you're looking for, please reach out to us for technical assistance or questions that we may be able to help you with. So feel free to get in touch and share your questions or comments with us. As soon as the webinar ends, you'll be directed to a quick follow-up survey. Please take 2 or 3 minutes and share your feedback with us and help shape this conversation and help shape the presentations that we give in the future. As we mentioned in the chat box and at the beginning, the recording for this webinar will be available soon, and you'll receive a follow-up email. So if you want to go back and look at any of the details or re-listen to anything, you're welcome to do so. And thank you everyone for joining us, and thank you Moses for presenting on this webinar. We hope to see you on Thursday for our expert panel of planning innovators, and have a good day.